All right, welcome to our safety PowerPoint. So within this PowerPoint, basically what we're going to talk about is some of the things that we need to be aware of when it comes to safety in the workplace, making sure not only ourselves are safe, but also our patients, visitors, and other people in the area. So the first thing I want to touch base on is electrical safety. So it's really important anytime we're using any type of electrical equipment that we're aware of the equipment we're using and our surroundings. If any of our power cords are damaged, we want to make sure we don't use those. Make sure that there's a cover on the outlet we're using. There's nothing hanging out of the wall. All these things are really important. Extension cords, we shouldn't be using those, especially in the workplace, okay? Reason being is they can be a hazard, tripping, falling, electrocution. A lot of different things can occur with those. So in the workplace, make sure we're not using any extension cords. When we are collecting blood, we want to make sure we are not using any electrical equipment, okay? So our electrical equipment are out of the way while we are collecting that blood. If possible, three-pronged plugs are the best when it comes to electricity, plugging things in. They're the safest, so we would prefer to use those. The next thing I want to get into is radiation safety. So the amount of radiation is determined by a few different factors. So let's talk about those first. The first factor is going to be time, meaning how long have we been exposed to this source of radiation? The next one is shielding. So did we have anything shielding us from that source of radiation? So for example, if anybody here has ever gotten an x-ray, what they do is the person that's receiving the x-ray, they lay like a lead blanket or a lead jacket or coat over the person on the area that is not being x-rayed. And that is what we would call a shield. If you notice, if you've had that x-ray, the individuals that are giving the x-ray step on the other side of the wall to give you the x-ray. Before they press the button for the x-ray to occur, they are shielded by a wall so that x-ray, that radiation isn't getting to them. Thirdly, we have how far is the person away, so the distance. So the three different factors we have now are time, shielding, and distance. How far is the person of the object away from the source? So how far are you away from that source of radiation? So it's really important to understand those three factors when we're talking about radiation. Obviously, by limiting the amount of time we're exposed to radiation is going to be very important. Making sure we have some type of shield so that can block us from any type of radiation, and how far away from that radiation we are, the farther the better. So the next thing we want to talk about is hazardous substances. But before we get into this too much, what is a hazardous substance? A hazardous substance is any chemical in the workplace that can cause harm. So let's think about the healthcare field. We are going to have a lot of different hazardous substances within our workplace, whether it be cleaning products, medications, different chemicals and things of that nature. All of those things can cause harm. So we want to be aware of what those are and how to handle them properly to make sure everybody in the area is safe. OSHA, which is the Occupational Safety and Health Administration, they regulate and control all of these hazardous substances to make sure we're being as safe as possible when using them. So once again, OSHA stands for Occupational Safety and Health Administration, and they are a government agency responsible for workplace safety. And that includes those hazardous substances as well. OSHA requires that healthcare employees understand the risks when dealing with such substances and how to handle them safely. And this just doesn't go for healthcare places. This is any place that has any hazardous substance in their facility. However, since we're talking about the healthcare field, we're going to relate to that for right now. The biggest thing OSHA talks about when it comes to hazardous substances is the labeling of these substances, making sure that there's labels on all of them. So not only we know what they are, what they contain, and how to handle them. There's different kinds of storages as well for these hazardous substances, and it's important that all of them are labeled. So if they're in bags, barrels, cans, cylinders, drums, storage tanks, all of these need to have labels that identify how to handle that substance. It should also have what we call a material safety data sheet. And I'll show you that in a few slides. You'll see what that looks like, and I'll go over it with you a little bit. But it includes all the information you need to know about that substance. And that would be where you would need to look at if somebody was exposed to a substance, it was mishandled, there was some type of error. That's exactly where you want to go, is that material safety data sheet. Here are a few different labels you may see on hazardous substance. You have your biohazard labels, the first two here, and poison. Just something to be aware of. You sort of understand what to look for. This is the MSDS, which is the material safety data sheet. All right. So if you notice, there's 9 sections here. So if you look at section 1, it's the product information. So what's the name of it? What's the use for it? Who manufactured it? Emergency contact phone number, the classification. All of that information is right there under section 1. In section 2, you have the different ingredients, and it's going to be very specific. What exactly is in this hazardous substance? In 3, the physical data. So what does this substance look like? Is it liquid, gas, or solid? Does it heat, freeze? What kind of different things happen if it's heated up, if it freezes, if somebody drops it? How flammable is it, and how do we extinguish it if it does become flammable? All right, so all of that information is in the physical data, which is section 3. Then in section 4 is fire and explosion data. Is it going to ignite? Will it explode? How do we deal with it if it does? How stable is it? How does it react under various conditions? As we move into section 5, reactivity and data, this is where we're talking about, is it compatible with other substances? When it decomposes, how does that work? All right, any information about the effects when it enters the body, immediate effect and long-term effect, all right? Section 6, toxicological properties. So exposure limits, how much can somebody be exposed to this, all right? Once again, immediate and long-term effects. 7, so section 7, it talks about preventative measures, personal protective gear. So what do we need to protect ourselves when we're handling this product? Do we need a mask or any type of ventilation? Any leak and spill information? How do we dispose of it? All of that is going to be in the preventative measures, all right? That's what we want to make sure we're looking at before we go to handle this product. We need to know, how do we protect ourselves and how does it need to be handled? Section 8 is very, very important just in case anybody is ever exposed to this, okay? So first aid measures. What needs to happen immediately after somebody is exposed to this, all right? What is the treatment plan? So if anybody's ever exposed to any hazardous material, what we do is we're going to go right to this MSDS sheet, this material safety data sheet. Look at section 8, the first aid measures, and it's going to tell us exactly what we need to do. Section 9 would be the preparation information. That's just who prepared it and how to contact them, all right? My biggest concern here is that you understand that Section 8 exists on this form. That way, if anybody's ever exposed, they can immediately go there and look. And once again, this should be with every hazardous substance, should be labeled and with the product. All right, so the next thing we want to talk about here is incident reports, all right? So when it comes to incident reports, these are things that we have to do in the healthcare field when something happens. And you'll see them done at other places as well. But when something occurs that is not normal, something happens, it might be to the patient, a visitor, a physician, staff, students, somebody that's on the property, something happens. So what we need to do now is fill out a form to explain what happened. So there's a lot of different reasons for incident reports. A lot of the common ones would be somebody had an accident, meaning maybe they slipped and fell and they hurt themselves. Maybe a patient fell. We would have to do an incident report on that. If there was a theft from a person or a hospital property, if there was an error with some type of treatment with the patient, including medication, or maybe you drew blood on the wrong person, that can lead to some serious issues and an incident report needs to take place. If somebody's exposed to any blood or bodily fluids, if somebody accidentally stuck themselves with a needle, incident report needs to take place. So when an incident report needs to take place, that is going to vary from facility to facility. So it's always important to follow the policies at the facility you work at. However, there's some usual general guidelines to incident reports. It should have the time and the date that the incident took place. It's going to have the time and date that you're writing this incident report. You are always going to put only facts into the incident report, not opinions, okay? Those are the basic guidelines for it. You want to state exactly what happened, when it happened, and the circumstances around it. Once again, only giving facts. This is one of those objective things, not subjective. Remember, objective means facts, subjective means opinion, all right?